Hey guys, welcome back to my channel. If you're new here, my name is Dr. Maushmi Das. In my last class, I spoke to you about the cervical fascia, the different layers of the deep cervical fascia and how it gets its attachment. Now continuing from there, today our topic will be about the deep neck spaces. Now the attachment of the cervical fascia is what leads to the development of all these potential spaces in the neck which we refer to as the deep neck spaces. So today we will be discussing about the different boundaries of the deep neck spaces, the contents, and how it communicates with each other. So let's start our class now. So today's topic is about the deep neck spaces. Now if you want to understand the different boundaries of the deep neck spaces better, you have to first know about the cervical fascia and its different attachments in the neck better. So to know about that, check out my last video. I have already covered everything you need to know about the cervical fascia. So now, starting our class today, we will be discussing about all the different deep neck spaces. We'll classify it first and then we'll talk about the different boundaries and the different contents of these spaces and how they communicate with other spaces. So the first thing we need to know is about the classification. How can we classify these potential spaces? We'll classify it according to its location. So broad classification can be the spaces which are located in the face and the spaces of the neck. So first talking about the spaces of the face, there are the Buccal space, the Canine space, Masticator space, Infratemporal space and Parotid space. The Masticator space in turn, it consists of 4 different components which are the Submasseteric space, the Pterygomandibular space, superficial temporal space and deep temporal space. Next, if we come to the spaces of the neck, it again can be classified according to its location, which is along the entire length of the neck, the suprahyoid spaces and the infrahyoid spaces. So along the entire length of the neck are 4 spaces which are the Retropharyngeal Space, danger space, Prevertebral Space and the Carotid Space. The suprahyoid spaces are the submental, the submandibular, peritonsillar and parapharyngeal spaces. And lastly, infrahyoid spaces is just one, which is the anterior visceral space. So we will first talk about the first space, which is the buccal space or also known as the Buccinator space. So this buccal space, it is located in the cheek and in between the skin and the buccinator muscles. So the boundaries of this space are anteriorly located as the angle of the mouth. So we will see over here, anteriorly is the angle of the mouth over here. Posteriorly is the masseter and the masseteric space. This is the masseter and the masseteric space. Superiorly is the zygomatic process of the maxilla, which blends with the fascial attachments of the temporalis insertion. Superomedially and inferomedially, the space is limited by the margins of the attachments of the buccinator muscle as over here. Inferiorly lies the depressor anguli oris, which is right over here. Medially lies the buccinator muscle and laterally lies the platysma, subcutaneous tissue and the skin. So basically the buccal space or the buccinator space lies superficial to the buccinator muscle and it lies deep to the platysma. So these are the boundaries of the buccal space. If you see in the picture over here, this here is the buccal space. This green space over here you can see is the buccal space. Even in the picture over here you can see this portion is the buccal space, the green portion, and in this picture here you can see this yellowish or orangish region. This is the buccal space. Now this buccal space has different contents. These contents are buccal pad of fat. The portion of buccal fat pad which extends posteriorly beneath the masseter and the ramus of mandible, and it becomes continuous with the adipose tissue of the infratemporal space or the fossa. It also contains the parotid duct, which is also known as the Stenson's duct. The Stenson's duct, it pierces the space at right angles Other than that, it contains the accessory parotid gland in about 20% people, facial and buccal arteries and its corresponding veins, the buccal branch of the facial nerve, and the buccal nerve of the mandibular division of the fifth cranial nerve. These are the different contents of the buccal space or the Buccinator space. And this space, it communicates with Pterygomandibular space, infratemporal space, submasseteric space and parapharyngeal space posteriorly, and with the canine space superiorly. So this here you can see, this is the buccinator muscle, and how you can see how it lies superficial to the buccinator muscle, but it lies deep to the skin and the platysma. This whole space is the Buccinator space. So this is about the Buccinator space. Next we move on to the canine space, which is also known as the infraorbital space. Now this space is located between the levator anguli oris muscle inferiorly and the levator labii superioris muscle superiorly. You can see in the picture over here, this red colored region is the canine space. So this term is derived from the fact is that space is in the region of the canine fossa, and infections originating from the maxillary canine tooth, it may spread to involve this space. So the boundaries of these space are: anteriorly lies the orbicularis oculi, you can see anteriorly lies the orbicularis oculi, posteriorly lies the buccinator muscle, superiorly lies the levator labii superioris, inferiorly lies the caninus muscle, superficially again lies the levator labii superioris, and medially lies the anterolateral surface of the maxilla. The canine space, it communicates with the buccal space posteriorly. You can see over here, this here is the canine space and this here is the buccal space. So you can see how it communicates with the buccal space and also with the submasseteric space over here. And the contents of this space are the angular artery and the vein and the infraorbital nerve. In the picture over here, you can see this bluish region is the canine space, and how posteriorly it is communicating over here with the buccal space. Next we move on to the masticator space. Now this space, these are basically paired suprahyoid cervical spaces on each side of the face. Each space is delineated by a superficial layer of the deep cervical fascia. Now at the lower border of the mandible, the superficial layer of the deep cervical fascia, it splits into two layers: an inner layer which extends deep to the medial pterygoid muscle and attaches to the skull base, and an outer or a superficial layer which covers the masseter muscle and attaches to the zygomatic arch. Now these two layers, they fuse along the anterior and posterior borders of the mandibular ramus, thereby enveloping the space. Now if you see over here, the boundaries of the space are: superiorly lies the skull base, medially lies the pharyngeal mucosa, laterally lies the medial surface of the ramus of the mandible, and posteromedially lies the lateral pterygoid plate, superior constrictor, tensor and levator palatini muscle. Now the masticator space is actually a huge space. We can divide it into four different spaces within itself. Now these four different spaces are the masseteric space or the submasseteric space inferomedially. You can see this is the masseteric space. The pterygoid space inferomedially, the masseteric space is inferolaterally. The superficial, this is the pterygoid space which lies inferomedially. The superficial temporal space which lies superolaterally, and the deep temporal space which lies superomedially. So these are the four different spaces which comprises the masticator space. The infratemporal space is actually the inferior portion of the deep temporal space, and the superficial temporal space and the deep temporal space together they are called as together they are known as the temporal spaces. And the masticator space, so it communicates with the pterygopalatine fossa via the pterygomaxillary fissure. Now coming to the content of this space, it contains the muscles of mastication, which includes masseter, temporalis, lateral and medial pterygoid muscles, contains the mandibular division of the trigeminal nerve, the internal maxillary artery, and the inferior alveolar nerve and vessels. So now we will discuss each of the spaces separately. The first comes the masseteric space. Now this is a potential space in the face which lies over the angle of the jaw, and it is paired on each side. It is located between the lateral aspect of the mandible and the medial aspect of the masseter muscle and its investing fascia. You can see in the picture over here, this here is the mandible and this here is the masseter muscle. The space in between this region is the submasseteric space. The term is derived from sub meaning under and masseteric referring to the masseter muscle. Now if we were to talk about boundaries of the masseteric space, anteriorly lies the anterior margin of the masseter muscle, posteriorly lies the parotid gland, superiorly is the zygomatic arch, inferiorly is the inferior border of the mandible, laterally is the masseter muscle, and medially is the lateral surface of the mandibular ramus. So the masseteric space is actually lying deep to the masseter muscle and superficial to the mandible. It communicates with the buccal space anteriorly, the pterygomandibular space and the parotid space posteriorly, and the superficial temporal space superiorly. And the masseteric space contains the masseteric artery and the vein. The next space is the pterygoid or the pterygomandibular space. Now this is a potential space in the head and it is also paired, and it lies between the medial pterygoid muscle and the medial surface of the ramus of the mandible. You can see here, this is the ramus of the mandible and this is the medial pterygoid muscle. So this space over here is the pterygoid space, also known as the pterygomandibular space. The boundaries of this space are: anteriorly lies the posterior border of the buccal space, posteriorly lies the parotid gland, superiorly lies the lateral pterygoid muscle. You can see over here, this is the lateral pterygoid muscle. Inferiorly lies the inferior border of the mandible, medially lies the medial pterygoid muscle, and laterally lies the ascending ramus of the mandible. So essentially this space is superficial to the medial pterygoid and deep to the mandible, and it contains the mandibular division of the trigeminal nerve, the inferior alveolar artery and the vein, spinomandibular ligament, and mylohyoid nerve and vessels. Now this pterygomandibular space has different communications as well. It communicates with the buccal space anteriorly, the lateral pharyngeal space and the peritonsillar space medially, submasseteric space laterally, parotid space posteriorly, and to the deep temporal and infratemporal space superiorly. Next we come to the superficial temporal space. Now the superficial temporal space is also a part of the masticator spaces. It lies between the temporalis fascia laterally, which is right here, and the temporalis muscle medially, which is here. So this space that you can see over here is the superficial temporal space. It is bounded laterally by the skin and temporalis fascia, medially by the lateral border of the temporalis muscle, inferiorly by the superior surface of the lateral pterygoid, superiorly and posteriorly by the attachment of temporalis to the cranium, anteriorly by the posterior wall of maxillary sinus and the pterygomaxillary fissure. It contains temporal pad of fat and temporal branch of the facial nerve, and it communicates with the buccal space and the deep temporal spaces. So this here you can see is a superficial temporal space. Next we move on to the last space of the masticator space, which is known as the deep temporal space. So the deep temporal space is a potential space inside of the head, and this is also paired, but this is located deep to the temporalis muscle. The superficial temporal space was superficial to the temporalis muscle, and the inferior part of this deep temporal space is also known as the infratemporal space. So this here you can see, this here is the deep temporal space. The deep temporal space is separated from the pterygomandibular space by the lateral pterygoid muscle inferiorly, and from the superficial temporal space by the temporalis muscle laterally. So, the boundaries of the deep temporal space are: laterally lies the medial surface of the temporalis muscle, which is this. Medially lies the lateral surface of the temporal bone. Inferiorly lies the superior surface of the lateral pterygoid muscle. Superiorly and posteriorly lies the attachment of the temporalis to cranium, and anteriorly lies the attachment of fascia to the orbital process of the zygoma. And this space, this is the space. This space contains the pterygoid plexus, internal maxillary artery and vein, mandibular division of the trigeminal nerve, and the skull base foramina, and it communicates with the buccal space and the superficial temporal space. Next, we come to the infratemporal space. As I said, infratemporal space is basically the inferior extension of the deep temporal space. This here is the infratemporal space. It is located posterior to the maxilla, between the lateral pterygoid plate of the sphenoid bone medially and by the base of the skull superiorly. Coming to its boundaries, it is bounded superiorly by the great wing of the sphenoid, inferiorly by the lateral pterygoid muscle and pterygomandibular space, anteriorly by the infratemporal surface of the maxilla and posterior surface of the zygomatic bone, medially by the lateral pterygoid plate and part of the lateral pterygoid muscle, posteriorly by the parotid gland, and laterally by the temporalis and the ramus of the mandible. The contents are the branches of maxillary artery, pterygoid venous plexus, and it communicates with pterygomandibular space inferiorly, buccal space anteriorly, cavernous sinus via the pterygoid plexus of veins. Next, we come to the parotid space. The parotid space lies behind the ramus of the mandible in and around the parotid gland. This space is formed by the superficial layer of the deep cervical fascia. I have spoken about this in my earlier video where I spoke about the different layers of the deep cervical fascia and its different attachments. I said how the superficial layer of the deep cervical fascia splits into two layers to enclose the parotid gland, and within this fascia is where lies the parotid space. The superficial parotid lobe is not completely encased by this fascia. The fascial layer is actually very thick superficially but very thin on the deep side. Therefore, when a parotid abscess usually bursts on the deep side to form a parapharyngeal abscess and then spreads to the mediastinum. And medially, the fascia communicates freely with the prestyloid parapharyngeal space, allowing for direct extension of the infection. So, you can see this space over here, this is the parotid space, and how it communicates with the parapharyngeal space right over here. This is the parotid gland. Now, the boundaries of this space are: superiorly it is bounded by the ESC, the apex of the mastoid process, and inferiorly by the inferior mandibular margin, and anteriorly by the masticator space. This here, as you can see, is the parotid gland, and it is lined by the parotid fascia, and in there is what lies the parotid space. So, the contents of this space are the parotid gland, intraparotid lymph node, facial nerve, external carotid artery, and the retromandibular vein. In the picture, you can see the one which is marked in purple here. This is the parotid space. In the parotid space, and just anterior to it lies the masticator space, and medially to it lies the carotid space right over here. So, this area is the parotid space. Next comes all the spaces which lies along the entire length of the neck. There are 4 such spaces: the retropharyngeal space, danger space, prevertebral space, and the carotid space. The retropharyngeal space. This is the area between the buccopharyngeal fascia of the middle layer of the deep cervical fascia and the alar layer of the deep cervical fascia. This is termed as the retropharyngeal space. So, if you see in the picture over here, the retropharyngeal space, the alar fascia, this is the alar fascia over here, and this is the buccopharyngeal fascia over here. So, the space in between these two layers is what is known as the retropharyngeal space. This space is also known as the posterior visceral space because it lies posterior to the pharynx and the cervical esophagus. This space is also called as Lincoln Highway of body, as it forms the pathway for the spread of infection to the posterior mediastinum. So, you remember this name, Lincoln Highway of body. This space acts as a bursa to allow the expansion of pharynx during deglutition. So, you see this space is a potential space which lies behind the pharynx. Now, coming to boundaries of the retropharyngeal space, superiorly lies the base of the skull. You can see over here, superiorly is the base of the skull, inferiorly is the bifurcation of trachea. So, the alar fascia fuses with the buccopharyngeal fascia at the level of T4 and the carina. So, this is the level of the T4 and the carina, and this is where is the lower limit of the retropharyngeal space. Laterally lies the carotid sheath and its contents. Anteriorly lies the buccopharyngeal fascia covering the constrictors of the pharynx. Posteriorly lies the alar fascia. You see, this is the alar fascia and this is the buccopharyngeal fascia. And this space it is divided into two lateral compartments known as the spaces of the gillette by a fibrous raphe. The content of this space are the lymph node of the Rouvier, also known as a retropharyngeal lymph node, the fat, loose areolar tissue, pharyngeal plexus of vessels and nerves, and it communicates with the parapharyngeal spaces anterolaterally on both the sides. Next is the danger space. The danger space lies in between the alar and the prevertebral fascia. So, in the picture over here we can see that this is the alar layer and this is a prevertebral layer. So, in between these two, the one which is lined in red color is the danger space. This extends from the skull base down to the posterior mediastinum where the alar, visceral and the prevertebral layers of the deep cervical fascia fuse. The danger space lies in between the retropharyngeal and the prevertebral spaces. So, this yellow colored thing is the retropharyngeal space, the red one is the danger space, and behind the danger space lies the prevertebral space. Now, this potential space is closed superiorly, inferiorly and laterally. Therefore, infections can only enter here by penetrating its walls. Coming to the boundaries of danger space, superiorly lies at the base of the skull, inferiorly lies the posterior mediastinum up to T1, laterally it fuses to the tips of transverse process, anteriorly lies the alar part of the deep layer of the deep cervical fascia, and posteriorly lies the prevertebral part of the deep layer of the deep cervical fascia. The clinical importance of this layer is that this space is so called because its loose areolar tissue offers a potential route for the rapid downspread of infection primarily from the retropharyngeal, parapharyngeal or the prevertebral spaces which lie all around it to the posterior mediastinum. This is important here, it spreads it to the posterior mediastinum which contains very important structures like the vena cava, the aortic arch, thoracic duct, trachea and the esophagus. This leads to major erosion of all these major vessels, lower airway and upper digestive tract, which is a major cause for death of the patient. This is why precisely this space is called as the danger space, because it has the potential to spread infection to the posterior mediastinum, leading to death of the patient. So, you see in the picture over here, this here is the alar fascia and this here is the prevertebral fascia, and between it this green colored space is the danger space. Also in this picture, the danger space, and you can see how the danger space goes down to the posterior mediastinum. Next we come to the prevertebral space. The prevertebral space is a potential space that lies between the vertebral bodies posteriorly and the prevertebral fascia anteriorly. You can see in the picture, this here is a prevertebral space, the white part over here. So posteriorly you can see the vertebral bodies lie posteriorly, and you can see the prevertebral fascia, which is this ash colored thing over here. The prevertebral fascia lies anteriorly. So if we were to talk about the boundaries of the prevertebral space, anteriorly lies the prevertebral layer of the deep cervical fascia, posteriorly lies the vertebral bodies, superiorly lies the base of the skull, and inferiorly lies the coccyx. And the content of this space are the paraspinous and the prevertebral muscles, scalene muscles, vertebral artery and the vein, brachial plexus, and the phrenic nerve. Next comes the carotid space. The carotid space is also known as the visceral vascular space. This carotid space is actually a potential space which is formed by the carotid sheath, which in itself is formed by all the three layers of the deep cervical fascia. To know how the carotid space is being formed by the deep cervical fascia, please check out my last video where I spoke about the attachments of the deep cervical fascia. Now the boundaries of the carotid space are: superiorly it is limited by the base of the skull and inferiorly by the arch of aorta. And this space contains the common carotid artery inferiorly and internal carotid artery superiorly, the internal jugular vein, ansa cervicalis, which is embedded in the anterior wall of the sheath, the vagus nerve, which lies posterior to the vessels in the posterior notch and extends below the hyoid to the mediastinum within the carotid sheath. And in the upper part of the carotid sheath, there also lies the 9th, 11th and the 12th nerve. And there are also deep cervical lymph node, which is the level 2, 3 and the 4. So infections may gain access to the carotid space after penetrating trauma, or by direct extension from the parapharyngeal space, or as a result of introduction of bacteria during injection of illicit drugs into the internal jugular vein. You can see these are the contents of the carotid sheath. This is the internal jugular vein, the common carotid artery, the 9th, 12th, 10th vagus nerve and the 11th nerve. So because the carotid sheath is intimately related to all the three layers of the deep cervical fascia, infections of the neck, regardless of their origin, may involve this sheath and its content. And because of the compact nature of the space and scanty loose areolar tissue in it, there is very little tendency for the infections to travel up or down within this sheath. Therefore, the infection will remain localized. Next, we move on to the suprahyoid spaces. There are 4 suprahyoid spaces. They are submental space, submandibular space, peritonsillar space and the parapharyngeal space. Submental space. This is a potential space which located between the mylohyoid muscle superiorly and the platysma muscle inferiorly under the chin in the midline. So you see over here, this space over here is the submental space. It is bounded laterally by the anterior belly of digastric. This is the anterior belly of the digastric on both sides. Anteriorly and inferiorly by the superficial layer of the deep cervical fascia, superiorly by the mylohyoid and posteriorly by the hyoid bone. It contains submental lymph nodes, areolar connective tissue and anterior jugular veins, and it communicates with the submandibular spaces posteriorly, the sublingual spaces superiorly via the erosion through mylohyoid. The submandibular space. Now it is bounded by superiorly by the floor of the mouth mucosa. This space over here is the submandibular space. Laterally by the mandible, antero-inferiorly by the anterior belly of digastric, posterior-inferiorly by the posterior belly of digastric and posteriorly by the hyoid. So, if see, looking at its content, it contains the submandibular gland, branches of facial and lingual artery, submandibular lymph nodes, hypoglossal nerve, nerve to mylohyoid, lingual nerve, and the sublingual space separately has the sublingual gland and Wharton's duct. So, the submandibular space can actually be divided by the mylohyoid muscle into two spaces. These are the sublingual space and the submaxillary space. So, the sublingual space is the one which lies above the mylohyoid. You can see this is the sublingual space which lies above the mylohyoid, and this is the submaxillary space which lies below the mylohyoid. So, these two compartments, they are continuous around the posterior border of the mylohyoid muscle, and it communicates with submental space anteriorly and medially, sublingual space posteriorly and superiorly, and the parapharyngeal space laterally. Next, coming to peritonsillar space. Peritonsillar space, it is a potential space between the fibrous capsule of the tonsil medially and the superior constrictor laterally. So, the boundaries are: medially it is bounded by the capsule of the palatine tonsil, laterally by the superior constrictor muscle, which is right over here. This is the superior constrictor muscle, the capsule of the tonsil medially, anteriorly by the anterior pillar and posteriorly by the posterior pillar. It contains loose areolar tissue and it communicates with the parapharyngeal and retropharyngeal spaces. Next, the parapharyngeal space. The parapharyngeal space is also known as the lateral pharyngeal space or the pharyngomaxillary space. It is an inverted cone with its base bounded by the petrous portion of the temporal bone and its apex lying at the level of the hyoid. Its boundaries are: it is divided into two compartments by the aponeurosis of zooxocandle and testud, the pre-styloid compartment and the post-styloid compartment, which are named according to their position relative to the styloid process. Before we go into the compartment, first we will talk about the boundaries. Now, superiorly it is limited by the skull base. Inferiorly it forms the apex at the hyoid bone. Posteriorly it is lined by cervical vertebra and the paravertebral muscle. Anteriorly by the pterygomandibular raphe. Laterally by the mandibular ramus, parotid deep lobe medial pterygoid muscle, and medially by the oropharynx and the nasopharynx. You can see over here in this picture, this here is the parapharyngeal space. You can see how medially it is lined by the oropharynx and the nasopharynx over here, and laterally lies the ramus of the mandible, medial pterygoid muscle, the parotid gland over here. Now, as I was telling you, it is divided into two compartments by the aponeurosis of zooxocandle and testud, the pre-styloid and the post-styloid compartment. This is in accordance with its position relative to the styloid process. So, the pre-styloid compartment, it contains fat, connective tissue, maxillary artery, inferior alveolar nerve, lingual nerve, auriculotemporal nerve, and the deep parotid lobe. This is the pre-styloid compartment. And the post-styloid compartment contains the carotid sheath and its contents, the 9th, 10th, 11th, 12th cranial nerve, sympathetic chain, and associated lymph nodes. So, this area here, right over here, is the parapharyngeal space, and how it can be divided into pre-styloid and post-styloid compartments. It communicates with other spaces too, that is the retropharyngeal space, the submandibular, parotid, and the carotid, and also the visceral spaces. Last of all is the infrahyoid space. There is only one of it, which is the anterior visceral space, also known as the pretracheal space. So, the anterior visceral space, also known as the pretracheal space, it lies immediately anterior to the trachea, as we can already know from the name. It extends from the thyroid cartilage to the superior mediastinum. The visceral space is formed anteriorly by the middle layer of the deep cervical fascia, which envelopes the thyroid and the trachea, and posteriorly by the deep layer of the deep cervical fascia. The contents of this space are the trachea, thyroid, parathyroid glands, larynx, cervical esophagus, recurrent laryngeal nerve, and cranial sympathetic chain. This here is the pretracheal space lying anterior to the trachea. So this is all about the different deep neck spaces, all the potential spaces with its boundaries, the contents, and how it communicates with other spaces. So this is all you need to know about the different deep neck spaces, its boundaries, contents, and its communications. And if there's any query you have about it, please write down in the comment section below and I'll be getting back to you. And guys, if you're liking my channel, please subscribe to it and press a like button on this video, and I'll be seeing you in my next class.